Kama'aina Kids takes care of your keiki across the state. And when we say keiki, well, we even mean infant and toddlers. And I'm here with Leslie Colby to talk a little bit more about the infant and toddler programs that you guys have at Kama'aina Kids. Tell us more about that.
Okay, we provide child care services and educational services for children 6 weeks to 24 months. We are a licensed program, and we follow the DHS licensing regulations. We also are accredited. Some of our programs are accredited. And we offer a curriculum designed for infants and toddlers, and this is a creative curriculum. It's founded on the principles of developmentally appropriate practices, and we believe that it contributes to positive development in young children.
Talk about how important that is, the caregivers that watch after our keiki.
Okay, so all of our caregivers in our program, they are trained. They have specific training for them. They also are pediatrics, CPR, first aid certified.
Very important.
We really believe that caregivers provide a special relationship with our infants, and we also believe that it cultivates the baby's sense of stability. It also helps with the self-esteem of the children.
Talk about the environment they expect here at Kama'aina Kids.
Well, one of the huge things that helps with the infant and toddler program is providing a very safe environment for children. The things that we have in our environment contributes to learning opportunities to explore, to grow, and to be able to just help in their development. So we provide block centers, dramatic play areas. We do areas where they can grow and explore on their own, so we want to make sure their environment is safe.
Yeah, and I love how they're both inside and outside, because learning can happen in the classroom and outside the playground too as well. Now, speaking of that too, food, meals. I know meals is an important thing, and in healthcare it's very, very important for the kids when it comes to meals. Talk about that.
Exactly. So we follow USDA protocol. So we provide formula, baby food, fruits and vegetables, rice, cereal, and we also encourage parents that do breastfeed to provide their own milk.
That's amazing.
As well as with their own special diets that the children are on. And when they're ready to eat regular food, well, one of the things that we do is that we also provide meals for the children like the rest of our preschool.
Oh, that's so cool. And again, that's so important at the young age, especially for the milk and when they learn. I got to ask, infant and toddler service, if there's a parent out there, well, why is Kama'aina Kid, again, the one-stop shop really for the place to go for that?
Well, one of the things that's really important is that we give people a peace of mind when their children is here, and we want to be able to provide a very safe environment for parents, and we want to reassure them that the services that we're providing for them is the best quality program. So one of the things that we do is we take photos of babies. We provide forms that shows them what happens in their daily care when they are with us. One of the things with having a center-based program is that people know that we're licensed and that the setting is safe and that they're secure.
And having that daily communication, knowing what your kid did that day while you're at work, is so much a peace of mind, isn't it?
Absolutely.
I love it. Now, talk about the class sizes, because I know that's important too as well in regards to toddlers and infants. What are the sizes that you guys usually
Okay, so licensing is required that infants are 1 to 4 and toddlers are 1 to 5. And what this does is just create a very intimate group setting so that they're secure for babies that are in our care.
When kikis cry, well, I saw it earlier. It's such a loving environment, but what you train for that? When kids cry, babies cry, how do you guys train and handle that?
And one of the things that we want to make sure is that all of their basic needs are being taken care of. So yes, eventually there's going to be 1 or 2 children crying, or sometimes more, and what we want to do is make sure that we're consoling each child as needed. And so we're taking care of all their needs, and the teachers do it in a very calm way.
Now, speaking of calm, when the kids go outside, it's a lot of fun, right? Here, talk about what it's like, especially the outdoor playing here at Kama'aina Kids.
So, because we service many different ages in our school, one of the things they do have is that the younger children have their own playground to go out and be able to have exposure to sensory areas and outdoor play that's safe for them.
And it's funny, but even 1 year difference, it does make a big difference in the age group when playing together, the sizes. I can see that makes a point.
Definitely.
Now, if anybody out there has any questions or wants to get more information, website, or what would be the best place to get more information?
www.kama'ainakids.com. And again, not all of our sites have infant toddler care, so it'd be best to go to our website and to look to see which sites have infant toddler care.
Well, that's what I love about Kama'aina Kids. You guys are across the state, and having all that selection makes a difference for the family out there knowing where to go. Well, thank you so much for having us. You know, it's nap time right now, so we have to be a little bit quiet, but I think we're having a great time. Thank you so much.
Thank you.